Nursing 474, Vulnerability and Vulnerable Populations, an overview. The weekly learning objectives include use evidence-based practices to care for vulnerable populations, choose strategies that can be used by nurses to improve the health status and eliminate health disparities of vulnerable populations, including governmental, community-based, and private programs, produce a resource list which could be used by vulnerable populations. Definitions and health risk. Vulnerable populations are defined as those at greater risk for poor health status and health care access. In healthcare, risk is an epidemiological term meaning that some people have a higher probability of illness than others. The natural history of disease model explains how certain aspects of physiology and the environment, including personal habits, social environment, and physical environment, make it more likely that one will develop particular health problems. However, not everyone who is at risk develops health problems. Some individuals are more vulnerable than others, and the web of causation model of health and illness better explains what happens in these situations. The interaction between numerous causal variables or factors creates a more potent combination, predisposing an individual to illness. Those at risk but not likely to develop the health problem are more resilient than their more vulnerable counterparts. Being at risk for a certain health problem is necessary for development of that problem, but it is not sufficient. Vulnerable populations are a subgroup of population who are particularly sensitive to risk factors and who possess multiple cumulative risk factors. Examples of vulnerable groups. Vulnerable population groups include the poor and homeless, pregnant adolescents, migrant workers, immigrants, the severely mentally ill, substance abusers, those who have been abused, victims of violence, people with communicable diseases, people who are HIV positive or have hepatitis B virus, and people with sexually transmitted diseases. Priority population groups are groups targeted by national governments for special emphasis in healthcare goals because their health status is poor. Health disparities. Vulnerable populations often experience disparities in access to healthcare, uneven quality of care, and the poorest health outcomes in comparison with other population groups. The Institute of Medicine defines disparities in healthcare as racial and ethnic differences in the quality of care that are not due to access-related factors or clinical needs, preferences, and appropriateness of interventions. Disparities refer to lower quality of care or poorer outcomes and may result from client-level factors, provider-level factors, or health system-level factors. Social and political factors also play a major role in disparities. Trends related to caring for vulnerable populations. In the 21st century, there is a renewed emphasis on caring for vulnerable population groups in the community through partnerships between groups such as public health, managed care, and community groups. Outreach is an approach to making health care more easily available to certain populations by implementing health education, counseling, or support services in places where people normally congregate, such as places of worship, schools, workplaces, and community centers. Case finding occurs when community-oriented nurses design methods for finding populations and individuals, especially in need of services. In some cases, lay health workers assist with outreach and case finding. A related trend is to develop culturally and linguistically appropriate forms of outreach and care delivery to more effectively promote the health of specific populations. Wraparound services are available social and economic services wrapped around the comprehensive health services. Comprehensive health services are health services that focus on more than one health problem or concern, are typically provided in community health centers and nurse-managed clinics, and are thought of as safety net providers, increasing access to health and social services for vulnerable populations. Landmark legislation. Even though laws may relate to only a certain proportion of the population, They tend to have a ripple effect and result in other groups following the general intent of the law. The Social Security Act in 1935 created the largest federal support program for older adults and poor Americans in history. Later, the Medicare and Medicaid amendments to the Social Security Act in 1965 provided for health care needs of older adults, the poor, and disabled people who might be vulnerable to impoverishment resulting from high medical bills or those with poor health status from inadequate access to care. Factors contributing to vulnerability. Vulnerability is a multidimensional and not simply a state of deficiency. Resource limitations, poor health status, and health risks are some factors that contribute to vulnerability. Social determinants of health are factors such as economic status, education, environmental factors, nutrition, stress, and prejudice that lead to resource constraints, poor health, and health risk. Lack of adequate social, education, and economic resources predisposes people to vulnerability and disparities in health outcomes. Economic status is strongly related to health. Poverty, a primary cause of vulnerability and growing problem in the United States, is a relative state. The federal poverty level is the measure used to determine eligibility for assistance program. The federal poverty level for 2007 was $22,050 for a family of four in most states. Poverty is a global problem that depletes human potential worldwide and creates economic, political, and cultural instability, all of which influence health. Poverty seems to be a major contributor to health disparities across racial groups. Poverty is more likely to affect women and children than any other groups. Education plays an important role in health status. More highly educated people are better able to make informed decisions about health-related issues. Health literacy is a measure of clients' ability to read, comprehend, and act on medical instructions. Access to health care may be more limited for lower socioeconomic groups. Barriers to access are policies and financial, geographical, or cultural features of healthcare that make services difficult to obtain or so unappealing that people do not wish to seek care. Subconscious discrimination related to specific populations or diseases, and culturally ineffective communication patterns by health providers may be other factors. Extreme poverty in the form of homelessness or marginal housing is related to risk for physical, dental, and mental health problems, food insecurity, and limited access to health care. Changes in normal physiological status predispose individuals to vulnerability. Outcomes of vulnerability may be negative, such as lower health status than the rest of the population, or they may be positive with effective interventions. Vulnerable populations are more likely than others to suffer negative outcomes, such as high levels of morbidity and mortality from health problems. Core functions of public health. The core functions of public health are assessment, policy, and surveillance. These functions parallel the stages of the nursing process, but are focused on populations rather than individuals. Assessment of groups is similar to assessment of individuals. Policies are population-level interventions. Surveillance refers to evaluation and monitoring to ensure that policies and programs are implemented as intended, that unplanned changes are managed effectively, and that goals and objectives are met. These things represent forms of social advocacy and promotion of social justice. Assessment issues. Nursing conceptual approaches. Nursing assessment of vulnerable populations may be organized around any nursing conceptual framework that takes into account the multiple stressors experienced by these groups and the particular difficulties they may have managing their health. The approaches of Newman's systems model, Roy's adaptation theory, and Orm's self-care theory are particularly well suited to community and public health nursing practice with vulnerable populations. There's also socioeconomic considerations. Because socioeconomic variables are important factors that predispose people to vulnerability, assessment should include evaluation of the adequacy of the individual's or family's social supports and economic self-sufficiency. There's also physical health issues. Nurses should explain to clients the value of preventative assessments. If the client agrees, the nursing assessment should include the evaluation of the client's preventative health needs, including age-appropriate screening. Biological issues. Vulnerable populations should be screened for congenital and genetic predisposition to illness and either receive education and counseling as appropriate or be referred to other professionals as necessary. Psychological issues. Vulnerable family members should be assessed for stress, healthy or dysfunctional family dynamics, effective communication patterns, caregiving capabilities, and the extent to which family development tasks are being met. Lifestyle issues. Vulnerable individuals, families, and groups face challenges in maintaining healthy lifestyles. Therefore, it is critical to assess their lifestyle factors, including diet, exercise, rest, and the use of drugs, alcohol, and caffeine. And lastly, environmental issues. Vulnerable groups are more likely to be exposed to environmental hazards such as pollutants or carcinogens than other groups. Planning and implementing care for vulnerable populations. This should involve a partnership between the nurse and client. Nurses who direct or control clients' care cannot establish a trusting relationship and may inadvertently foster a cycle of dependency and lack of personal health control. The roles of the nurse when working with vulnerable population includes case finder, health teacher, counselor, direct care provider, monitor and evaluator of care, case manager, advocate, health program planner, and a participant in developing health policies. Client empowerment and health educations. Nurses should help all vulnerable groups achieve a greater sense of personal empowerment through health education and facilitation of acquisition of necessary resources. Levels of prevention. Healthy People 2020 emphasizes improving health by modifying the individual, social, and environment determinants of health. Strategies for promoting healthy lifestyle. Healthy People in Healthy Communities provides suggestions for community-wide strategies to develop and maintain healthier communities. Comprehensive services. In general, more agencies are needed that provide comprehensive services with non-restrictive eligibility requirements. Resources for vulnerable populations. Nurses should know about community agencies that offer health and social services for vulnerable populations. Case management. Case management involves linking clients with services and providing direct nursing services to clients such as teaching, counseling, screening, and immunizing. Evaluation of nursing interventions with vulnerable populations. Evaluation of therapeutic nursing interventions begins with client goals and objectives and focuses on the extent to which client outcomes are achieved. Evaluation takes place while providing care and gives the nurse a basis for revising therapeutic interventions to make them more effective. Evaluation also takes place when a case is closed or when a program is completed. And then it gives the nurse data to use in providing care to similar clients or programs in the future.